Earlier this spring, a team from Waco submitted a project to the National Leadership Academy for Public Health. The project we proposed was to establish three thriving collective impact teams to work on three Waco health priorities: obesity, access to health care, and women's health. The project was accepted, and the four team members, Kayla Stone, Natalie Kalinsky, Ramona Curtis, and Ashley Thornton, traveled to Atlanta for 3 days of intensive sessions with public health gurus from around the country. Part of what we learned in Atlanta is that we need to have a thorough understanding of the context and network within which we'll be working. We also decided that one of our first steps to move the project forward needs to be to establish a working structure and a shared understanding of who is responsible for what as we continue our work. The purpose of the first set of slides is to present to you some of the history and context within which we think that we are working, and to get your feedback to make sure we understand it correctly. Public health is inextricably entwined with other issues, most obviously poverty, so this set of slides attempts to put this project into the context of not only the health work that is going on in town, but the big picture in regard to work that is being done to build up Waco in general, with particular emphasis on reducing poverty. The second set of slides is our draft of a structure for moving forward. We would also like your feedback on that idea. A good starting place for this discussion is the Waco Community Visioning Project. At the end of 2004, then Mayor May Jackson convened a group of leaders to develop a vision for our community. In the process of developing that vision, 11 town hall meetings were held throughout the community with the specific purpose of getting input from a wide range of people. Meetings included gender diversity, age diversity, race and ethnic diversity, geographic diversity, and socioeconomic diversity. This process established 5 priorities, among them increase economic opportunities and enhance life outside the workplace. Goals under the Increase Economic Opportunities priority included create, grow, and attract businesses and jobs to retain our educated workforce and accommodate returning talent, increase average incomes, increase the overall level of education in McLennan County, and develop an understanding that the entire community shares responsibility for educating every citizen. A specific goal within the Enhance Life Outside the Workplace priority is to ensure access to high-quality health care now and in the future. One of the most important initiatives to come out of the Waco Community Vision so far has been the Greater Waco Community Education Alliance. Formalized in 2009, the Education Alliance has a mission to develop an understanding that the entire community shares responsibility for educating every citizen. As a part of fulfilling this mission, the Education Alliance has hosted 6 summits. These summits have been critically important venues for sharing information about the current state of education in Waco and initiatives that are underway to improve our educational outcomes. Of particular importance to this project, the organizers of the Education Alliance quickly realized that educational outcomes are intertwined with health outcomes and the socioeconomic status of families. The annual summits grew to become an important channel for sharing information about those subjects and their effects on education. In 2009, right about the time the Education Alliance was really taking shape, a small group of concerned citizens led by Jimmy Durrell of Mission Waco and Kenneth Murby, who had just retired as director of Caritas, made a presentation to the City Council regarding the need for a more intentional approach to reducing poverty in Waco. The City Council was interested in this idea and encouraged the group to develop it further. This group went on to meet for several months, gathering information from community leaders, social service providers, and low-income Waco residents. Based on this information, they developed 12 aspirations that described a holistic approach to the problem of poverty. They went back to the City Council and requested the city appoint a more official committee to work on pursuing that objective. The City Council appointed the Poverty Solutions Steering Committee, or PSSC. This group met for several months and, with the help of students from the Baylor School of Social Work, collected ideas from other communities and from practitioners and other leaders in Waco regarding how to move forward. They presented their report to City Council in June of 2012. The PSSC made 6 key recommendations, including establish a common vision, measure and report progress together toward that vision, build a clearinghouse for collecting and sharing relevant research and information, spur effective engagement by educating our community about these issues, use multiple mechanisms to regularly gather input and ideas from the community, harness the power of focus and continuous improvement, and establish an organization to provide ongoing coordination and leadership for our work together. Their first recommended next step was to form a leadership board of individuals in the community who had interest in moving the work forward and access to resources to make that happen. The mayor and the city council accepted the report, and the mayor set about the task of forming the leadership board. Once formed, that leadership board renamed the initiative Prosper Waco and sharpened the focus from the 12 aspirations to 3 main priority areas: health, income, and education. Meanwhile, a group of folks involved and interested in Waco-McLennan County health issues also began to meet, initially focused on mental health. This group began to discuss other health concerns in the community and what might be done about them. On another front, the Public Health District and several partners had been conducting community health needs assessments every 5 years for some time. With the advent of the Affordable Care Act, this needs assessment process became even more of a priority. The schedule was stepped up to every 3 years, and hospitals and other partners came on board for the process. Upon the completion of the 2013 Community Health Needs Assessment, some of the initiatives and discussions around health began to come together. Based on the Community Health Needs Assessment, the Mayor's Health Leadership Group established the Community Health Improvement Plan, or CHIP, working group. The CHIP group, with representatives from a wide variety of health-related organizations around town, established 3 priorities: obesity, access to health care, and women's health. They established 3 sub-teams to pursue these 3 priorities and a steering committee made up of the chairs of each of the sub-teams plus a facilitator to organize the effort. The CHIP obesity subteam quickly realized that they had much in common with a group that was already working in town. The Live Well Waco initiative, supported by a community transformation grant, was already working to reduce obesity and chronic disease and to reduce tobacco use in our community. The CHIP obesity group decided to merge with the Live Well Waco obesity group. On yet another front, another group was forming with the mission of connecting and mobilizing African American leaders across organizations to maximize effectiveness in addressing issues of key concern to our community. This African American leadership organization, the ALO, chose health as one of their first priorities and worked with the Public Health District to host a health forum to share information with the African American community and to gather ideas from them about how to coordinate efforts and move forward. The National Leadership Academy for Public Health team drew 3 members from the CHIP Steering Committee: Kaylor Stone, Natalie Kalinsky, and Ashley Thornton. Ramona Curtis joined from the African American Leadership Organization. She is also now a member of the CHIP Obesity Subteam. Another important part of the context of this work is that for at least the last few years, more and more of the people who are involved in these various groups have become familiar with and interested in using the collective impact model as a model for organizing our work together. This model was developed to help communities make progress together against complicated issues such as public health and poverty. The experts in this model emphasize the importance of 5 success factors: a common agenda, shared metrics, continuous communication, mutually reinforcing activities, and a backbone organization. The CHIP team has been explicitly attempting to use this model to organize their work together. As you may have noticed, the NLAPH team explicitly stated that using the collective impact model is an important part of their proposed project. Other leaders and some of our community foundations recently put the resources together to invite collective impact experts to come to Waco to share more information about this model and about how we can best use it to make progress on all 3 of the Prosper Waco priorities. And speaking of Prosper Waco, conversations are ongoing on how to best unite these multiple efforts under the umbrella of Prosper Waco. The thought is that the Mayor's Health Leadership Group will morph into the health branch of Prosper Waco. Some research work currently being conducted by consultants from the Upjohn Institute will eventually morph into the income branch of Prosper Waco. And the Education Alliance will continue their good work as the education branch of Prosper Waco. Is there anything you would like to add to this description of our history and context?